Tonight we are playing a little push your luck game called Sausage Sizzle, where you're rolling dice, different characters who are trying to grab food off a sausage sizzle, and as you go your sort of options of how you can grab things diminish a little bit, making a little bit tighter decisions. It's a fun game, plays up to 5. More important than the game though is my guest tonight. Dave, you're working in drug and alcohol as a welfare worker, lived experience welfare worker.
Yeah.
While I get started doing my roles, where each round I've got to lock in a dice, can you tell me a little bit about your experience getting from, using substances to becoming a welfare worker?
Yeah, well, like I was saying just before we went on camera, I was an addict. I went through a lot of different drugs, and I started sort of drinking when I was young, and then started smoking cannabis, when I was about 16. And by the time I hit sort of 18, I was using heroin, and and then I was pretty much full-blown addict and alcoholic from a pretty young age. Yeah, and that's how I got into the field. It took a while because it took me about, I started using when I was like 14, 15, and by the time I was 30, I was trying to get clean. I started trying to get clean when I was about 25, I suppose, but it wasn't successful until I was sort of like mid-30s, So it just took a long time, and it's a long road, and a lot of things happened in those times,
I think that's interesting, as I've obviously working in drug and alcohol as well, but like a lot less experience and not having that same lived experience, is sort of having an understanding of that beforehand, but really seeing it firsthand. There is that journey of recovery. It's not just deciding or hitting rock bottom, quotation marks, and deciding to stop and go into a detox and a rehab, and then suddenly everything's all right.
Yeah,
it's
a journey. It's a journey. It's a personal journey, and you're the only person that can make the decision to stop using. We can sort of like have our clients and patients and say, you got to do this and you got to do that. But it's a personal journey, and it's the person who is making that decision is the only person who can get clean. It's got nothing to do with anyone else. We can advise people. I don't know what.
Yes, that's your role. So your lowest number is a 3, and you've got 2 of these, so you're gonna get 6 points, and then that character is then used up.
Yeah. Right. Okay.
Yeah. I mean, there's certainly education and medical stuff we can provide, but it is up to the person.
Yeah.
I think what was interesting is I think a lot of people probably don't understand the difference between someone who uses substances and someone who's an addict.
Yeah.
And and I think you sort of off camera when you were telling me a little bit more about your sort of background, you talked about you'd been sober for a while.
Yeah.
You're going well. You had a job, and then someone invited you to a Christmas party.
Yeah. And because you get into, it's what they call in 12-step programs, it's stinking thinking, or it's just, you just sort of get to a point in recovery when you feel as though, hey, I'm all right, I'm not really an addict, I think I can probably drink, just like everyone else, you just lie to yourself, or you just sort of tell yourself that you're not an addict, you're okay, I'm not really like that, I can just pick up. And I tell you, if you're an addict or an alcoholic, you cannot touch anything, because as soon as you do, there's a saying in AA or NA, one's too much, 1,000's not enough. And that's exactly what it's like. I mean, if you have one drink, you'll end up having 1,000, and 1,000 won't be enough because you just want more. And I went through that for, like I was saying before, I went through 15 years, I think, of bouncing off the walls, spending time in jail. I spent 6 months in Grafton Jail in 1990. I spent 12 months in Parramatta and Long Bay up in Sydney, and Junee, which is down near Wagga, in 1993. That was just doing geographicals. That was trying to run away from it. I spent a lot of time in Western Australia. I spent 4 years in the UK, travelling around Europe. I was okay for a lot of that time, you know, but I was drinking a hell of a lot, but I was sort of okay. And, but, you know, I came home from the UK, and then I just spent the next 5, 6, 7 years bouncing off the walls, you know, around Australia, in and out of detoxes. I would have done over 30 detoxes, in and out of hospitals, country hospitals. I think I was in Rockhampton for 6 months, and I went into the Rockhampton hospital 6 times for a week or 10 days detoxing, you know, because I think a lot of people just don't understand the disease of addiction, and they just, you know, doctors and nurses will just throw you in hospital because they know you're very sick. And I was going through periods where I was having lots of seizures, and I'd end up in hospital. And
so obviously you've gone through sort of like a long and hard process that has its ups and downs and its relapses for trying to get and then stay sober.
Yep.
And that's also led you to now, and for you know, over 20 years being a lived experience welfare worker, helping other people who have been in that same, or who are going through that same situation now. And obviously you work with other people and other healthcare professionals, you know, nurses and doctors and other welfare workers who might not have that lived experience, but, you know, are still working in the same field.
Yeah.
Do you think that having that lived experience is really a big asset for helping other people going through that?
Absolutely. Because I know for a fact that people would rather talk to me than maybe you, Liam. You know, you work in drug and alcohol. You're a psych nurse. You're a good nurse. You're a really good nurse, and you look after them. But I mean, like, you haven't lived that experience, so you just don't know what they're going through, really, literally.
Yeah, no, I'd agree with that.
And I do, you know, and so I can sort of talk to them and say, listen, you know, guys come in and they've been in jail, and I know that. I know what they've been through because I've done it. They come in and they're as sick as dogs. They're just throwing up and, you know, really, really sick, as we see. You know, we see it all the time at work. And I've been there, done that, so I know exactly what they're going through. So they can talk to me, and I get it so often, you know. You're the one I can, you know, Dave's the one we can talk to because he's been there, done that. But we need guys like you, though, and we need professionals in there as well. You can't all be, you know, just lived experience workers.
Because I found that in psych wards as well, they do have lived experience workers who have you know, experienced mental health issues, and it's sort of, you know, for a while it has been you know, they're still managing it now, as you do, but that it is, when you take out, because you're looking at nurses and doctors, a lot of it is looking at medication and looking at physical health. And when you have someone who is still providing care, but they're sort of like, well, they're looking after that side of things, we're looking after the rest, is it removes the, especially in psych where it's like, there's issues with, you know, maybe they don't want to be on certain medications, and it can be quite complicated, but it's like, well, you'll speak to them about that. I'm here to talk about your experience. And it's sort of having someone who has that lived experience who they can relate to more is really valuable, not only for the team, but more importantly for the clients.
Absolutely. And it's invaluable for the team, you know, to have someone like me in there that can explain to you guys, you know, what these guys are going through. You know, and I know that for a fact. I mean, I've been working there, as you say, you know, 23 years, you know, it's a long time. And I've worked with probably, you know, at least 100 different people. And they learn from me, I learn from them, you know, and it's, and it works out well that way. I mean, like, you know, we both, you know, work together well because, you know, we have different aspects of, you know, knowledge, you know. And I've got the knowledge. I've been there, done that with them. I know exactly what they're going through. And you've got the other knowledge with, you know, with your study and your, you know. And I did a bit of study myself too, you know, to get there. But it wasn't a nurse, it was just more a drug and alcohol studies worker, you know. And I went to school and did a couple of years of school before I started the job,
Just to, I guess, with wrapping up, well, obviously we talked about some quite heavy stuff. While playing quite a silly game, which is a little bit of juxtaposition. But I guess if there's, we don't know, like, there's definitely a lot of services people should reach out to. They need help. But having that over 20 years of experience working in AOD, is there anything you'd say to anyone who's watching who might be experiencing?
Yeah, I would say get help. You know, you're not going to do it by yourself. You need help. I mean, like I said before, it's up to the individual. It's up to the person who is going through it. They have to make the decision, but you need help. And as I say to our clients all the time, go to an AA meeting, go to an NA meeting, you need peer support. I mean, like, you're never going to do it on your own, but it is a personal journey. It's sort of like everyone has the same issues, but they have different journeys. You know, I mean, like, you know, all our clients, they've got different journeys, but they've got the same result. They're addicts, they're alcoholics. You know, their life is out of control. I mean, they wouldn't be coming to us if their life wasn't out of control. And if there's anyone out there that needs help, pick up the phone and ring. You know, there's plenty of services in this city, in this state, in this country, and it's free, you know. There's so many services that you can ring up and you can go. The best thing to do would be to go to a detox, get yourself detoxed with us, and then get yourself into a rehab and spend 6-12 months sorting it out, because it's going to take that long. You can't just do it in a week. You know, people come into our unit and they think that they can stay 7, 8 days, 10 days, and everything's going to be okay because they'll just walk out the door and they'll be fine. But it doesn't work that way. You know that you need help, and you need long-term help, and you need peer support. And peer support is what you get from rehab and from 12-step programs. You know, I spent so many years going to 12-step programs, NA, AA meetings, and hating them. Going, I don't need to be fucking here. What's this? You know, this is bullshit. I don't need this crap. But in the end, that's what got me clean and sober. It was going to NA meetings. I went to a place called the US Society, where a prerequisite of being there was to go to an NA meeting every day. In the end, I was doing 15 meetings a week. I was doing 2 every day and 3 on Saturdays. And I tell you, I met so many people and so many peers, so many people just like me, who not all of them made it. And I could probably name 20 people that are no longer with us, that I got clean with, you know, but, you know, not everyone makes it. And as I tell you, they say it's jails, institutions, or death is the only result from addiction and alcoholism. You know, and they're both the same thing. Addiction and alcoholism are both the same thing. And there's only 3 results: jail, institutions, or death. So you're going to be either locked up in a community care unit with schizophrenia, or in a psych ward, or you're going to be locked up in jail for 20 years or whatever, or you're going to die. And mostly it's death, you know. And we see it all the time, don't we? You know, we have, how many times do we hear clients, oh, you remember such and such? He was here last week, he's dead now.
You do see the results of people.
The results of people, and they die. It's death. And so if anyone watching this needs help, just get it, you know, and you will get it, you know, and we'll make sure, won't we? You know, we'll make sure if they come into our unit, we'll make sure they get all the help they need, you know.
Dave, thanks for sharing your story and your experience working in drug and alcohol.
Yeah, no problem. Cheers.